Okay, so I'm beginning with the initial scan of the room. There is a mirror in my room, but I will not be filming in front of it. This is my videographer, Anaya. My supplies, my patient, Ariella, my draping. Okay. So to begin, my name is Nicole Broomfield. Okay, and I'm going to be starting my head to toe assessment now. So to begin, I'm going to sanitize my hands with hand sanitizer. I'm going to don a clean pair of gloves. And then I'm going to also clean my stethoscope with a sanitizing wipe. All right. I'm going to draw the curtain for patient privacy. Are you comfortable?
Yes.
Okay. Do you need to use the washroom?
No.
Okay. Are you comfortable in the seated position?
Yes.
Okay. Can I just start by getting your name and date of birth, please? Can you tell me your name and date of birth?
Ariella Richards, September 22nd, 2012.
Okay, wonderful. Thank you so much. Okay, so Ariella, today I'm going to be doing a head-to-toe assessment of your systems, okay? At any point in time, if you're uncomfortable, please let me know.
Okay.
Okay, so first I'm going to start with a general survey.
Yeah.
I'm just looking at your overall,
Yeah.
okay?
Okay.
So to begin, I would say that your physical appearance, your age is appropriate to your identification. I would also say that you have no body odor. For your body structure, I would say that your body is symmetrical. I would also say that you don't have any visible masses. You don't have any visible deformities. And then I would also say for your behavior, you have a neutral facial expression. Your mood is positive and happy. Your speech is clear, and you're able to keep eye contact. Okay, just looking at your work of breathing, it's not labored, and you're currently not in any distress. Okay. Also, I just want to ask you a few questions. Can you tell me the day?
Today is July 22nd. July 26th, 2025.
Okay, wonderful. Do you know where you are?
Yes, I'm at a clinic.
Okay, wonderful. And can you also tell me, so you've already told me your name. Can you just repeat your name?
My name is Ariella Richards.
Okay, great. So I would say that you're oriented ×3 and you're alert and you're awake.
Yeah.
Okay? So just taking another look at your head, okay, I'm going to be looking at your facial features, okay? So for your head, I would say that your head is midline and proportionate to your body. I don't see any involuntary movements in your face. I don't see any swelling. I don't see any type of lesions. I don't see any type of scars.
Okay.
Okay, so I'm going to do some tests on your face.
Okay.
Okay, I'm going to ask you to smile. Okay, wonderful. Can you show your teeth? Perfect. Can you frown? Okay. Can you raise your eyebrows? Okay. Can you close your eyes tightly? Okay. I'm going to also apply resistance while you're closing your eyes. Try to open your eyes. Okay, wonderful. Can you puff your cheeks? Puff your cheeks like this. Wonderful. Okay, great. So your cranial nerve number 7 is intact, which is the facial cranial nerve. It is intact and it's symmetrical on both sides.
Okay, great.
Okay, from there I'm going to ask you, I'm going to do an assessment on your eyes. Okay, I'm just looking at your eyes. Can you close your eyelids again? So I don't see any eyelid lagging. I don't see any swelling. I don't see any type of redness. Your eyelashes are evenly distributed. The hairs for your eyebrows are evenly distributed. I'm going to also ask you to open your eyes. I'm going to take a look at your sclera. Just look down for me. So your sclera is white with visible blood vessels. Now I'm going to look at your conjunctiva. Can you come closer a little? Your conjunctiva, can you look up? Is pink and it's moist. Okay, wonderful. Now I'm going to do some assessments with your eyes. First, I'm going to measure your pupil size. So your pupil size is 3 millimeters. I'm just going to shine some light into your eyes. Okay. Wonderful. Can you cover one of your eyes? Just look ahead, okay?
Okay.
So I'm going to shine some light into your eyes. Okay, responsive. And then the other side, responsive. And can you follow the pen with me as well? Just look at the pen. Okay, wonderful. So I just tested for cranial nerve number 3, which is the ocular motor nerve, and it is intact. And Perla, her pupil size is equal. Her pupils are rounded, responsive to light, and there was accommodation. So her cranial nerve number 3 is also ocular motor nerve is intact. Okay, from there, I'm gonna go to your ears. Okay, I would say that your ears are both symmetrical. I would say that there's no discharge. I don't see any discharge. Okay, wonderful. And then I'm going to also take a look at your nose. Can you tilt your nose up? Okay, so for your nose, I would say it's midline to your face. I don't see any visible discharge. And I would also say I don't see any deviated septums. Okay?
Okay.
Wonderful. Okay, from your mouth now, I'm going to take a look at your lips. It's okay, close your mouth. Your lips. Okay, so your lips are pink and they are moist, which is wonderful. Okay, and then now I'm going to also test your cranial nerve number 9 and your cranial nerve number 10. Okay, I'm going to use a tongue depressor. I'm just going to ask you to open your mouth and say ah.
Ah.
Okay, I do see that the soft palate in your mouth and your uvula both rose, so that's great. Your cranial nerve number 9, which is your hypoglossal nerve.
Yeah.
Your glossopharyngeal nerve. And your cranial nerve number 10, your vagus nerve, are intact. Okay?
Okay.
Wonderful. Okay, now I'm going to also test for your cranial nerve number 12.
Yeah.
Okay? So for your cranial nerve number 12,
yeah.
I'm going to ask you to stick out your tongue. Okay, so your tongue is midline. Can you move it side to side? Okay, wonderful. I'm going to ask also, okay. That's fine. So your cranial nerve, can you also say light, tight, dynamite?
Light, tight, dynamite.
Can you say it multiple times?
Light, tight, dynamite. Light, tight,
okay,
dynamite.
Wonderful. So your cranial nerve number 12 is also intact.
Okay, good.
Okay, so now I'm going to take a look at your neck, okay?
Okay.
So just observing your neck, I don't see any visible masses. Your thorax your trachea is midline. I don't see any enlargement of the thyroid gland. The skin is the correct proportion to your ethnic background. I don't see any crepitation in your neck as well, and I don't see any lesions. I'm going to also palpate your neck now. Okay? I'm just going to feel your neck. Okay, so I don't feel any masses. Your skin is warm to touch. There were no lesions there. I didn't see any type of deformities there in your neck. Okay?
Okay.
And also, I'm gonna test for your cranial nerve number 11 now, which is your spinal accessory nerve. Okay? I would like, before I test for your spinal accessory nerve, I want to test or do a reading on your carotid arteries on both sides.
Okay.
So I'm going to count them for 30 seconds. Or we'll do this for 30 seconds. Okay, so your carotid artery, I would say that you have 75 beats per minute. It is 2+, and it is strong.
Okay.
Okay, and they're equal bilaterally.
Perfect.
Okay, now I'm going to also check for your cranial nerve number 11.
Yeah.
With your cranial nerve number 11, I'm going to ask you to shrug your shoulders and I'm going to apply resistance, okay?
Okay.
Okay, can you go ahead and... Okay, wonderful. Your cranial nerve number 11 is intact.
Okay.
And that is the spinal accessory nerve. Okay, wonderful. So from there, now I'm going to do your upper extremities. Okay, so just starting to take a look at your upper extremities. I do see here that you do not have any physical deformation, you don't have any deformations, and that your elbows, your joints, in your hands, can you stretch out your hands? Elbows and your joints, there's no visible swelling. I don't see any visible lesion. I don't see any masses. Now I'm gonna actually feel for your extremities. Can you hold out your arms again? Okay, so I would say that they're also symmetrical on both sides. They're warm to touch. There's no lesions, no deformities, no crevices. And then also I'm gonna do this for your carotid arteries. I'm sorry, your radial artery. I'm gonna just feel for your pulse. Can you stretch out your arms? I'm gonna count it for a few moments, okay?
Okay.
For 30 seconds. So after 30 seconds would have elapsed, I would have seen that her rate was 75 beats per minute, 2+, strong and equal bilaterally. Okay, so I'm gonna do your lower extremities now, okay? Do you mind stretching out your feet and your legs? Okay, so I also, just by general inspection, I see that you don't have any no deformities, there's no swelling, there is no edema, there's no lesions, no redness, okay? I'm gonna be touching your legs now bilaterally. Okay. You don't have any joint inflammation. You don't have any pitting edema. No crepitation in the joints and the lower limbs. Your skin is warm to touch. And there is no clamminess. Okay, thank you very much. Now I'm gonna also check for your lungs and your thorax. Okay. I'm just gonna start by first taking a look. I want you to turn around if possible, please. Okay, all the way around. Okay, I'm gonna ask you to just raise up your shirt.
Okay.
It's okay. Okay, just keep your back as straight as possible. Okay, so just from general observation of your back, your contour is flat. Your just looking at your thorax, your contour is flat. I don't see your color is appropriate for your cultural background. I don't see any skeletal deformities in your spine. I don't, and also I would say that there's no visible masses. So now I'm gonna palpate your thorax. Okay, so after palpating your thorax, I would also find that there's no masses, no swelling, warm to touch, no pulsation, no thrills. Now I'm going to also listen for lung sounds, breath sounds. Just breathe as normal, okay? Take regular breaths, avoiding the scarla. Just breathe in and out. Okay, thank you so much, Ariella. Okay, so for your lung sounds, I would say, or your breath sounds, I would say that I did not hear any adventitious sounds. I didn't hear any crackling or any wheezing. Okay, can you turn around? Okay, wonderful. So now I'm just going to take a look at your respirations in the front and observe your anterior thorax. Okay, so just breathe as normal, okay? So I would count this for 30 seconds. So her respiratory rates are going to be 12 breaths per minute. Her rate is her respiration is not labored and regular. Okay, thank you. Okay, so now I'm going to take a look at your cardiovascular. I'm going to ask you to just raise your shirt underneath your breast line. Okay, so now I'm going to be looking at her apical rate. Okay, I'm going to be auscultating for this. The landmark for this is going to be mid-clavicle at the mitral valve in the 5th intercostal space. So I'm going to take a listen. I'm going to count for 30 seconds. Okay, so after the 30 seconds would have elapsed, her rate would have been 75 beats per minute, 2+ strong and regular. Okay, after this, so now I'm going to ask you, Ariella, to lay down. You can go all the way up. Okay, just lay down flat. You have a good angle?
Yes.
Okay, I'm going to just cover you proper draping. I'm going to take a look at your abdomen. Okay. Just providing draping for privacy. Okay, so first I'm going to do a general inspection. I'm going to see that there are no visible swelling or masses. I'm going to come to the base of the bed. I'm going to see that her umbilicus is midline. I would see that she has no visible aorta like pulsation. There's no excessive pulsation, and she doesn't have any visible masses. Now I'm going to actually take a listen to her bowel sounds. I'm going to start in the lower right quadrant. Upper right quadrant, upper left quadrant, lower left quadrant. Okay, so I would say that her bowel sounds are low-pitched gurgling sounds, and she had 2 bowel sounds for 5 seconds. And now I'm going to palpate the bowels. Gentle pulsations. Okay, and I would say that Ariella has no abnormal masses. I would say that she was warm to touch. I would say that there was no tenderness or pain. And I would also mention that the rebound was normal. Okay, that has completed my full head to toe assessment. Thank you.